Tell me about the most difficult patient you've had to take care of is one of the most common new grad RN interview questions, hands down. Hiring managers are going to ask you this question because they want to know you have the tools to not shut down when you deal with difficult patients. A lot of new grads immediately jump to the most acute to answer this question, which is a valid way to do it, super valid. But if you're stuck with this, you can't think of a response, think about it this way. Sometimes the most difficult patient isn't the most sick. It can be a patient who's emotionally challenging, or maybe they have multiple minor illnesses, making it very difficult and complicated to coordinate their care. Whatever you go with, just make sure you emphasize how you made the patient feel safe, supported, and cared for. Here's an example answer. During nursing school, I was helping take care of this 80-year-old man who had just been diagnosed with cancer. He had always been healthy his entire life, rarely had gotten sick, and so being in the hospital and dealing with treatments like being on TPN was new to him, and it irritated him. It frustrated him. He would refuse vital signs, he would refuse blood sugar checks, and at one point in the shift, I went in to try to recheck his blood sugar, and he just exploded on me. Why are you doing this? Why are you here? So I gave him a moment, and I just told him, look, I know this sucks. This is terrible. I understand you're going through something awful, but what I, my preceptor, and the rest of the healthcare team want is your safety. We want what's best for you. We're trying to care for you. He apologized, and he just told me that he felt like he was losing control, and so I told him that my preceptor and I would do everything to update him so he knows what's happening and why. He still kept denying some of the treatment, but he became a lot more willing to participate in his care. The whole experience taught me that the most difficult patient doesn't always mean the most acute. It can be an emotionally challenging patient that sometimes just needs somebody to listen to, and by providing therapeutic communication, we were able to give the safest, most effective care. Something like that with a small and confidence. And if you want more of the most common new grad RN interview questions, I have an ebook in my bio with everything you need to get hired, every question you need. I hope that helps, and follow me for more new grad tips.